We welcome the digital health lead of Unite Network, which is a global network of parliamentarians committed to achieving political impact towards ending infectious diseases as a global health threat. So please welcome Akarsh Venkatasubramanian, from Unite Network.
Good morning, good afternoon, good evening to everybody present here at the AHIN General Meeting. This is Akarsh Venkatasubramanian. I lead Digital Health and Innovation at the Unite Parliamentarians Network for Global Health. Over the next 10-15 minutes or so, I will give a brief introduction to the Unite Network itself, and also touch upon our work specifically on engaging parliamentarians and elected officials in digital health innovation. So, without further ado, um, the first slide on the screen, to build a generation of political leaders in global health. This is, in a sense, one of the perhaps the main vision of the Unite Network for the next few years. We are today a network of 200 and over 230 members of parliament and elected officials from over 85 countries. This growth has happened in the last 5 years. Unite was founded in 2017 by Dr. Ricardo Baptista Leite, a Portuguese member of parliament, and within the auspices of the UNAIDS Foundation, and in the 5 years since, we've grown to become an independent global network of over 230 parliamentarians, as you can see. This includes regional, national, state-wise, senators, deputies, local parliamentarians as well. So all around the spectrum. We are non-partisan, we are non-profit. So this offers really a global platform for discussions, across between parliamentarians across countries, across regions, and how equitable we are will come up in the next slide as well. The last 5 years has seen Unite focus specifically on the elimination of infectious diseases as a global health threat by 2030. In the wake of the COVID-19 pandemic, in the wake of the United Nations Sustainable Development Goals and the political declaration for the United Nations High-Level Meeting on Universal Health Coverage, Unite has, as of last month, expanded our vision to become the Parliamentarians Network for Global Health. As a worldwide collaborative network of policymakers and partners, Unite's members are convinced that no life should be limited by infectious diseases or any other global health threat. Our efforts will be focused on helping countries using our parliamentarian network to accelerate progress towards universal health coverage. So it's an excellent connection to today's theme. Unite basically focuses on advocacy. We've been focusing on our activity in providing our members, parliamentary members, elected officials, on engagements, so connecting with the different stakeholder networks that you see on the screen. Specifically in terms of digital health and innovation, this is coming in really crucial this year. The structure at Unite has traditionally followed a couple of teams on parliamentary engagement and partnerships. But as of last year, a decision was taken to focus on policy desks vertically as well, that are basically thematic areas of work. Last year saw the beginning of the policy desk on drug policy, and this year we have begun the new area of work on digital health and innovation. And this is exactly how this slide shows exactly how specifically we focus in terms of our policy desks. As the technology engine, as the technical engine, as the the content engine of Unite, if you may. The policy desks, and specifically the thematic area of work on digital health and innovation, provides content to our network, to our members on parliamentary engagement, on technical engagement. For example, um, we've got 10 chapters. As you can see, Unite is divided into 10 global chapters, each headed by a regional parliamentarian. For example, coincidentally, there is one on Asia Pacific. India and China are separate given the size and the UNAIDS classifications that have been followed. But in addition to the 10 chapters, there is, of course, as well a non-executive board and a secretariat that I represent today. And this secretariat supports our parliamentarians, supports our global work through, for example, our content engines and policy desks. So in terms of digital health and innovation, we've identified three very broad areas of engagement with parliamentarians. This includes recognition of the fact that parliamentarians are majorly involved in three activities. One, creating and changing laws. Two, voting budgets. And three, holding governments accountable and influencing governments when the need arises. So in terms of digital health and innovation specifically, this could be creating new legislation, for example, creating parliamentary commissions on global health, on digital health, on innovation, following, for example, the German example, or it could even be voting in extra budgets to create more infrastructure that allows digital health scale up, digital health implementation, more budget to allow more health workforce to plug human resource gaps that even further expand digital health innovation and so on. How do we do this? How do we do our work? So in addition to the subcommittees and the policy desks that we've just spoken about, as of last year, Unite has co-founded and co-leads a new platform called the International Forum on Global Health, which brings together different parliamentary groups from different organizations. For example, the Unite network is accompanied by the Parliamentary Network on the World Bank and IMF, the African Parliamentary Forum, the Global TB Caucus, and the other groups that you see on the right. And the main focus of the IFGH, the International Forum on Global Health, very similarly to the main focus of the policy desks, remain engaging the parliamentarians on specific activities and campaigns. So, for example, on parliamentary roundtables, on policy briefs and position papers where appropriate, on the promotion of advocacy and communications campaigns, on capacity building sessions. Earlier this month, about last week, 6 days ago, we held our first in-person campaign on digital health innovation in Argentina, hosted within the Senate, supported organization by the commission, the Health Commission, and the Senate of Argentina themselves, in collaboration, co-organized with the University of Buenos Aires. So this was a brief parliamentary briefing and inquiry that brought the parliamentarians together with subject matter experts on digital health over a series of sessions, and then finally focusing on lobbying. So it's a very specific kind of focus. I'll come to the event in just a minute or so. But what comes next for Unite? So for the next 3 years or 5 years or 10 years, depending on our progress towards universal health coverage by 2030 and other factors, next for Unite, of course, the policy desk on digital health and innovation. There is a lot of work ongoing through the parliamentary engagement team, for example, on pandemic preparedness and response. Human rights are very central to all the work that we do. Respecting, protecting, and upholding human rights as ensconced in the United Office of the High Commissioner for Human Rights Charter and the Universal Declaration for Human Rights and the different international covenants. are really crucial to our work. So when we talk about global health policy labs, for example, and regional policy labs, which we plan in the regional countries, we will follow this theme, if you may, to create first a stronger and more integrated network that goes beyond chapters, to continue creating platforms such as our parliamentary inquiries and roundtables, but also virtual platforms for policymakers in global health, creating labs with the vision that we prefer to make this very regionally focused and regionally independent, creating capacity in the regions to function on their own, in plain terms, and finally to create a window of opportunity for impact. In Unite was created as a network focusing on impact, focusing on action, focusing on advocacy, and it's going to stay the same. It will continue to be a network that focuses on impact. So political impact to reach universal health coverage at the moment is our focus. And using this through policy, our policy desks, our parliamentary roundtables, our international fora, and the different platforms is the focus of our work for the next few years. Now, specifically on digital health and innovation. So earlier this year, there was widespread, of course, there's been widespread recognition for a few years now that after the United Nations Sustainable Development Goals were adopted in 2015, after the political declaration for the UN high-level meeting on universal coverage was adopted in 2019, aiming to achieve these goals by 2030, we are not on track. It's quite clear that we need a game changer at the moment, potentially in terms of technology innovation, given that we are in the middle of the fourth industrial revolution, given that we're in the middle of a technology revolution, and parliamentarians, especially in health, governments, parliamentarians, senators, the senates, often find difficulty in keeping up with the rate of innovation. In order to do this, we unite as a network. Unite as a network earlier this year established the area of work on digital health innovations as the world's foremost global network of current and former elected officials, specifically focusing on the global health agenda. Unite's members are convinced that political will is crucial for UHC, and they're also convinced that UHC requires, as it stands, really equitable and meaningful reengineering of existing global health systems. So in order to do this, whether these are through digital technologies that our colleagues at PATH and the Patrick McGowan Foundation had earlier, in WHO had spoken about it, and so Global Fund. This could be electronic health record systems, telemedicine, health management information systems, patient communication, e-health, m-health, the wide variety, to see what tools are usable in which country, in what capacity, by which stakeholders, which parliamentarians are pushing forward this agenda, and how. And these questions are crucial, are central to our investigations over the next couple of years. We understand that enabling policy environments are not straightforward. We understand that we often need to connect parliamentarians with the other stakeholders in this environment. So this specific hub on digital health innovation, the Digital Health Innovation Hub, seeks to be a one-stop source of reliable, credible resources for the parliamentarians to take forward these plans in their own countries. And coming back to seeing that parliamentarians have three major roles in this area, which is either creating and changing laws, or voting budgets, or influencing governments. We support, as Unite, we support parliamentarians to deliver these plans through the Digital Health and Innovation Hub. And this hub is advised by a steering committee that actually constitutes of a couple of organizations present at this event today as well. And 7 parliamentarians from across the different regions that we work with. Very specifically, our next few years are going to be focused on political action plans in 3 countries. This is really to understand, to gauge the political landscape in which we will be working, for implementing digital innovation plans where necessary. And our 3 countries of focus are going to be Argentina, India, and Tanzania. For various reasons, for the regional leadership, for the global participation, for the maturity of digital health innovation in these countries, for the accessibility of health services, and how digital health can improve that, can enhance that. So for the next couple of years, our specific activities will involve local actors, global and regional actors as well, but very specifically local actors specialized in the delivery and accessibility of these health services. We'll, as Unite, we will make a thorough assessment of the political landscape and local appetite for policy reform and stay on that side without spending time on additional resources and so on. We recognize that there are many additional resources out there today. The real need in those resources is to implement them on a country level, to adapt them and adopt them on a country level. So working with PATH and Digital Square, working with WHO, working with even Transform Health and other organizations with research products is very crucial to our work. Our political action plans will potentially follow a very specific workflow. So the stage 1 will be on information collection and political assessment, where we currently are. And the stage 2 will be monitoring, curating, analyzing info, which we are at for Argentina. This information will help us create stage 3, which is a political strategy and policy position. In Argentina, that's, for example, that's very clear. There is a clear need for a global legislation that covers different digital health tools. There is currently a legislation that came out during COVID-19 specifically on digital prescription, but not on electronic health records and telemedicine and other tools. So we need a global, conceptually global legislation. And in India, of course, this may be different. In Tanzania, it may be different. But that stage 4, beyond the political strategy and policy position, will be to act, to develop, to implement, to monitor political action plans, and support our parliamentary networks to do so. We really understand at the end that, to repeat myself for a third time, our work will be on three levels. In Argentina, it's quite clear that legislation is the major need. So creating and changing laws is something that is crucial to our work there. In India, for example, this could be a voting budget question. Maybe perhaps a position paper can guide an eventual political action plan on a very state-specific journey through India on budgets or maybe on legislation again. And in Tanzania, we expect that it will be a mixture of the 3 major focus areas for parliamentarians: creating and changing laws. We have excellent parliamentarian members in Tanzania, part of our network. We're very active both on a national and a regional level. So necessary laws we expect will be around, if not already, and will be strengthened. Voting budgets and influencing governments stay crucial roles for our parliamentarians as well. So in terms of specific deliverables, we're going to focus on inclusion of digital health innovation as Unite's core priority. We focus on establishment of a small group of members of parliament from high-income and low-and-middle-income countries who are interested in digital health. So countries such as in Latin America, Argentina, Colombia, Mexico, Costa Rica, in Asia, India, Indonesia, Malaysia, the Philippines, in South Africa, Kenya, South Africa, Tanzania, Zimbabwe, in Europe, Germany, Switzerland, Netherlands, Norway, and so on. And thirdly, we will focus on the development of political action plans specifically. and utilize our summit as an opportunity to create these capacity building activities and partnership building. Um, the specific one, very specific target is to establish within 2 years a target of 5 global health subcommittees. This is in the example of Germany's global health subcommittee, where our chapter chair for Western Europe is vice chair in Germany. 5 specific global health subcommittees will be something that we can aim at. I'll stop there. Right at the end of the 20 minutes anyway, and available for any questions. Thank you.
So we thank Akarsh and Unite Parliamentarians Network. And it's interesting that this network of digital health advocates is also in a network or in partnership with Unite Network as well. So you can see how precisely how digital health needs other sectors actually to make it work.